there are some strategies for preventing UTIs. One, hydration. You want to make sure that your body is adequately hydrated, that you drink enough water, because having a nice urine flow will help to prevent you from getting UTIs. It'll help keep the urine from being stagnant, just sitting there, waiting for bacteria to multiply. Instead, when you're drinking a lot of water, that allows the fluid to move, the urine to flow, and it allows any of those bacteria that sneak up there to be flushed out, goodbye, in the urine. Be sure to watch my video on the 7 huge benefits of drinking water after you finish watching this video. Also, having a healthy diet that is low in processed foods, low in sugary foods. You want to avoid added sugar, and this can help, especially if you're a diabetic. Diabetics are at a higher risk for UTIs. And so, yeah, avoiding added sugar can help to prevent UTIs. Practicing good hygiene is important. Now, yes, everyone has a natural flora or some bacteria that is normal to have in the urinary tract area. However, we don't need any extra bacteria. So make sure that you bathe frequently and that you keep yourself clean. And ladies, when you're wiping after you urinate, make sure you wipe from front to back. If you mess around and wipe from back to front, you're inviting all the bacteria from the backside into your urethra and your urinary tract. No bueno. That's bad news. And teach young girls, okay, when they're old enough to urinate, they're old enough to learn to wipe from front to back because, yes, children can get UTIs too. Oh, and ladies, another way to prevent UTIs, remember when we talked about the honeymoon cystitis, the bladder infection or UTIs that women get after sex because women have short little urethras? Well, after you have sex, please don't just sit there and be in your afterglow. As soon as you're finished having sex, get up and go and urinate. Here's how it helps. If you get up and urinate, instead of the bacteria just sitting there and being able to crawl up your short little urethra, ladies, and get into your bladder, if you get up and urinate, then you flush out those bacteria that are trying to crawl up and you prevent the UTI. So now, let's talk about when you need to seek medical help, okay? When do you need to call your physician? Well, if you're having any of these UTI symptoms, you need to go ahead and contact your physician. And what will be done is they can do a urinalysis with micro, okay? And they can do a urine culture where they see which bugs are growing in the urine, okay? They'll see which bacteria are there. And they can also find out which antibiotics will work for your specific type of a UTI. Usually, the treatment is about 3 days of oral antibiotics for women when it's an uncomplicated UTI, and maybe up to 7 days for men. It can be longer depending on your medical complications or your personal risk factors. If you have some of the more serious symptoms that I mentioned, like fever or back pain or vomiting or blood in the urine, well, this means that the urgency is heightened. And yes, you want to try to contact your physician, but if you can't, you may need to go to the emergency room because these symptoms can mean that you have pyelonephritis, okay, the infection of the kidneys, and it could mean that you have that sepsis or an overwhelming infection. And this could lead to a complication called septic shock, which could be potentially fatal, okay? So the fever, the vomiting, the blood in the urine, the back pain, you definitely want to seek medical help urgently. And as far as the treatments, usually doctors are able to treat the UTIs with by-mouth antibiotics, but once you get to that point of having sepsis or overwhelming infection, then very likely you will need IV antibiotics. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. As always, I appreciate you for watching. I appreciate the support, and I want you to do your best to live your healthiest, happiest life.